This is BoomerLife on CL 650.
We're back. This is Boomer Life. I'm Joanne Sutton, and today we're talking about Parkinson's and the Parkinson's movement. Joined in the studio with ParkinsonSociety BC CEO Jean Blake, and also with us today is physiotherapist Nina Bloomfield. Nina, thanks for joining us.
Thank you very much for having me.
Excellent. Now, Nina graduated from the University of Toronto back in '84. She's been practicing physiotherapy in the Tri-Cities for over 25 years. In the past, she's worked in the public health sector at Eagle Ridge Hospital and in home health. Currently, Nina works for Fraser Health in pulmonary rehabilitation, as well as part-time in private practice, focusing on neurological physiotherapy. Nina leads some therapeutic exercise and adapted yoga classes for persons with neurological conditions affecting their mobility, as well as specific yoga and active exercise classes for people with Parkinson's disease. Now, Nina, I know there's a lot more to your background, and we hope to expose some of those details, but tell us now how you made that direct connection with what you do in physiotherapy and people with Parkinson's disease.
Well, I guess I've always been drawn to work with people with neurological problems. I'm not sure exactly why, but even with my fairly general experience working particularly in home health, I always, if there was patients with Parkinson's that came with referrals, I would often be the one that would take them on. I've taken some different continuing education classes. I guess it's a real fascination for me with the brain, and certainly the more recent research on neuroplasticity and how the brain actually works, and the change within my own career in terms of how we understand neurological problems has really driven me to learn more and then apply that to try to help the patients and the people that I encounter.
So it was more of a general interest of yours than a direct connection to say you knew somebody with Parkinson's.
That's correct. And yet when I reflect back, I would say in my first week as a physiotherapist in a hospital in Ottawa, I had a Parkinson's patient, and it's sort of like it stuck with me. And of course, the treatment at that time was completely different than it is now. But over time, it seemed that I was continually drawn to work with people with Parkinson's, and I've always been interested with working with people with other neurological problems as well.
So can you share with us a little bit of how physiotherapy actually helps a person with Parkinson's disease?
So physiotherapists are basically experts in the movement system. And so a lot of people are more familiar with physiotherapists that work in orthopedics, that after they've had an injury or that have different pain conditions. But really, physiotherapists are trained to look at the whole movement system, which includes our muscles, our joints, our nervous control. And also there's a sense that, especially as we understand movement and the general connection of the body systems, there's a big aspect of the mind, the emotions, motivation, and so physiotherapists are really able to integrate looking at the different systems that come into play when we actually go to move, whether you're working with a geriatric person, with a child, an athlete. We're trained at being able to take a holistic approach and try to see what are the factors that we can manipulate, what we can improve. I'm a strong believer that there's always something that can be changed, and I'm always in awe of the human body and the capacity of the human body.
So you're obviously up for the challenge. Maybe you can tell us or share with us an experience of some of the things you might actually do with a patient.
Well, so particularly when it's working with people with Parkinson's, when you think about the nature of Parkinson's, it's a slowly progressive disease, and by the time a person gets their Parkinson's diagnosis, there's actually approximately 70% of the dopamine-producing cells that already have degenerated. So on one hand, it's shocking to think that there's that much degeneration, but then that speaks to the fact of the capacity that the brain has to still manage and enable our body to do its bodily functions, despite that. But these issues like slowness of movement, the mood disorders, they're happening slowly and insidiously. And because of the brain's ability to adapt, we learned ways to get around it. But because the nature also of the human person and nature in general is to follow the path of least resistance and to create habits in order to find ways to cope with all the multitude of possibilities that there are. So as Parkinson's develops and people's movements start to get smaller, as I think Dr. McCowan described, that sometimes it's not the person that realizes that maybe they're stepping smaller or their arm isn't swinging. It's other people who notice it. So we sort of just adapt to it. So that's neuroplasticity, maybe in a negative vein. Then we can take neuroplasticity, which is the ability of movement to change the way the brain operates. We can take it in a positive direction and expose the body to different kinds of movements in order to then relearn. It's really all about skill acquisition and relearning. Just as at any age and stage we can learn new things, people with Parkinson's also have that capability, and they also have other challenges that then make that need to learn even more important.
Almost an adaptability.
Yes, yes. But and in order to, so the adaptability can lead us into the habit that maybe isn't optimal, and then as we expose our body to other ways of moving, so for instance, the example of a small movement, then we, in physiotherapy, we will train people to do certain exercises to push their body beyond what we call the self-selected effort of the movement or the size of the movement, because as we start to move smaller, our brain starts to think that that small movement is normal. So we have to almost recalibrate the brain in our movements. But then we also need to look at the issues that anybody might have. We, particularly as we get older, maybe as we develop Parkinson's, we've slowly become less physically active. We might put it down to our age, but then we might be somewhat weaker. We might be a bit stiffer in general, as well as the Parkinson's causing some rigidity in the body. So we also want to address things like strength, flexibility, balance, and of course the cardiovascular system, because fitness is really important for all of us, but especially for people with Parkinson's.
So is pain an actual symptom of Parkinson's?
It certainly can be a symptom of Parkinson's.
So then how would you deal with an individual who says, oh my gosh, I'm in so much pain. How could I possibly do physiotherapy?
Well, I think like with everybody, you have to meet them from where they are. And we know that different kinds of movements can help with symptoms of pain. So it's a matter of doing an individual assessment of the person to find out what areas can be enhanced. Maybe there's an area that needs to be stiff, and we just start small and continually work with the person in terms of motivating them. But not just motivation, also dovetails with education. So if you educate the person, they understand, then they may have some less fear also associated. We know that fear also takes a big role in kind of propagating behaviors that where people want to avoid their pain. But as we start to explore the edges of the pain, not moving into the pain, but moving into positions where we are comfortable, then we can start to be more comfortable with expanding our movement.
It's all very much a scientific approach.
Yes.
Now, when we spoke with Jean in the first segment of the show, you really stressed the importance of exercise. Is this a new discovery that exercise is such a vital component to recovery and maintenance of this disease to be symptom-free?
It's relatively new when you look at the fact that we've known about the disease for a very, very long time. And we still don't know what causes it, and there is no cure, but there has been increasing research around the benefits of exercise. And definitely for symptom control, we've seen that it is beneficial. Again, increasing research around this neuroplasticity motion and also some neuroprotection. There's a thought that if it's not keeping more dopamine producing cells from dying in the brain, that maybe there are some other hormones that are being replaced that are serving a temporary role of dopamine in helping with movement of the body. So we're really pushing exercise. We say start where you're at. You should, of course, consult your doctor, make sure that it's safe if you have been sedentary for quite some time. But as Nina said, it's about retraining the body. And as much as it's a disease of the brain, if you haven't been using your muscles, you also have to get them back in shape. So
that's right. You have to feed the brain, which in turn feeds the muscles.
Yeah.
And
so we really say, get started. We have a program launching tomorrow, World Parkinson's Day, called Step by Step. It's not in every community, although people are welcome to start it if they want. And they can find out more about it by going to our website, parkinson.bc.ca. And the Parkinson's movement is very much about individuals setting their own goals. Again, they can go to our website to find out more about that. And it does have a fundraising component to help us produce even more exercise programs across the province, as well to help us fund more research.
Nina, could you talk a little bit more about this power training program?
Sure.
What it is and how it fits into this whole program of Parkinson's?
So certainly there's been a lot of general research into different kinds of exercise that can help with Parkinson's, but there's a number of researchers that have been looking at certain types of exercises that are specifically targeting the symptoms of Parkinson's, as we've mentioned: rigidity, slowness of movement, tremor, problems with posture, balance, etc. So there's a physical therapist from Arizona. Her name is Becky Farley. She's a neuroscientist as well as a physiotherapist, and she's developed a program called POWER, PWR, which stands for Parkinson's Wellness Recovery. And she has developed a series of movements and more concepts. It's less a specific list of exercises and more general concepts that should be included in an exercise program for someone with Parkinson's to basically aim at the specific issues that are presented, that people with Parkinson's present with. And there's a continuum of exercises that can be done along all the stages of the disease. But one of Becky's sort of goals is to eradicate. Parkinson's actually is divided into 5 stages, where stage 5 is the stage where a lot of people think about with Parkinson's. It's more when people are very immobile and perhaps bedbound. So her goal is, if people with Parkinson's start exercise early and continue doing exercise and continue getting reassessments and advice on how to exercise, that will eradicate stage 5. So it's basically about maintaining your function and actually preventing slowing down the progression of the disease.
What kind of results have you seen from people that have been, or the patients with Parkinson's that are involved in this program?
Well, people really feel more confident. Their balance improves. They feel it all. The actual success that they experience from being engaged in an exercise program that is relatively vigorous. People have the sense that, oh, people with Parkinson's, need to exercise gently. No, they have to be pushed in order to cause the changes in the brain that we want to happen, and then that results in a greater sense of self, of confidence, and that itself actually causes a little burst of dopamine into the system for anyone, but especially important for people with Parkinson's, and then that helps them to feel more hopeful about their future. So dealing with a chronic disease is complex and involves the mind, body, and the spirit. And so these exercises can help on many different levels. And part of the POWER program is to not just aim at the physical system, but also at the cognitive, the thinking mind, where you're feeling, and also the autonomic, so the automatic things like sleep, pain, issues of constipation that Dr. McCowan mentioned. They can all be improved by engaging in a kind of holistic, whole body exercise program.
Absolutely. So now that we really have it established that it's a disease of the brain, how does depression fit into this?
Well, I mean, I think
it's a factor, obviously.
Absolutely. So we consider Parkinson's as having it's a movement disorder, so it has motor components, but there also are non-motor aspects of Parkinson's. So depression can be also influenced by the chemical imbalance that occurs with Parkinson's. So it can be actually a symptom of Parkinson's. Some physicians are thinking that might be an early sign of Parkinson's. And then you can also have the reactive depression when you get a diagnosis and thinking about your future and that kind of the natural stages of grief we go through when we are given bad news can lead to some depression. But then, of course, information, activating, putting control back into your life can be very helpful. And we actually know that exercise is in and of itself is helpful for people with mood disorders if we can, just separate out depression. So really, there's very few medical conditions that exercise isn't good for. And of course, if you do have medical conditions or a combination of different issues, seeing a health professional, a physiotherapist, is really the best way of getting a specific exercise program that meets your needs.
Jean, how does the society help individuals get involved in some of these programs like the power training, or to actually help them find a physiotherapist, an expert such as Nina?
Yeah. We have a 1-800 referral service, so people can phone us and we will try to connect them with what's available in their community. And Dr. Farley is coming up. We've brought her up several times before to train physiotherapists. That's happening again this fall. And we have a new training program that she's developed for certified fitness professionals who can get 15 continuing education hours with their professional association. So we'll be advertising that, and again, those physios and fitness professionals can go to our website to find out more information.
Excellent. You're listening to Boomer Life. I'm Joanne Sutton. Today we're talking about Parkinson's and the Parkinson's movement. Joined in the studio this afternoon with a Parkinson's Society BC CEO Jean Blake and physiotherapist Nina Bloomfield. Join the Parkinson's movement. Thank you, Nina, for joining us today. You can get more information at the website parkinson.bc.ca. This is Boomer Life on CL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.